questions and comments that have been coming in. I wanted to thank the audience for some really great questions, and please do keep them coming in. But for the first one, what I'd like to I'd like to stick with you, Sheetal, and Anne, perhaps, a question for the two of you, which is you both have spoken to some extent about the methodological challenges of a lack of data, and I think one of the consistent experiences for outbreak response is that the most urgent time for answering these questions can often be at the beginning of the outbreak, and also when you have the least amount of data. And Sheetal, you mentioned, for example, the importance of uncertainty, but I was just hoping to have perhaps some personal reflections from both of you on how, as modelers, you manage that dialogue between, if you like, the scientific and technical side, and the side from the policymakers who are asking so strongly about these questions. So perhaps if I start with Anne and then over to Sheetal.
Yes, sure. So this is, of course, an excellent and very important question. And again, I think the key word, as Sheetal said, is uncertainty. It's very important, and not all models or modelers do that, to be very clear about the sources of uncertainty in the results and to clearly highlight those uncertainties. Actually, Juliet, who's a co-author on Sheetal's presentation, once, so from CICIMA, once made a presentation that I really liked, where she showed model results without a central trend, but just a lower and upper bound. So highlighting the uncertainty without showing a central scenario, because really our models show, anything between those two bounds could happen. And I thought that was really clever. I think, of course, that doesn't help policymakers, because they have to make sort of binary decisions. Do I do this or do I not do this? And if you say, well, this is the amount of possibilities, it's maybe not very useful. So I think the key for me is a clear dialogue, and not, like in-person dialogue with the policymakers, to really understand why they want the result of an analysis, what policy question are they trying to address, and so that we can sort of address that as best as we can, given the uncertainty. And then I think our role as modeler, and I've tried to do this a little bit in the past, is also to highlight what kind of data could be collected and at what point in time during or before an epidemic, in order to reduce those uncertainties. So it's been striking for me that in some of my work, when an epidemic has started, we don't even know where or how many people live in the affected area. And these should be data that we should focus on collecting outside of an epidemic, because really there's no need to wait until the epidemic kicks in. As I said, and again, it's great to hear about the Taiwan project to do this. Collecting quantitative data on behaviors throughout is really important. So I think we have to sort of be the liaison between the policymakers and the data collectors, but really with a dialogue where we show what's possible, what's not possible to address a question, and we also try and highlight the need for data that's maybe clinicians and people in the field don't see the value of immediately, because it's not going to help take care of one patient, but it's going to help to understand the big picture.
Fantastic. Thank you, Anne. Sheetal?
Thanks. So just to add to what Anne mentioned, I think the key is dialogue. With if we think about the urgency of the decisions to be made, we can write long and beautiful reports, but not everyone's going to have time to sift through and understand and really work through the reports. And also, as scientists, we often have the problem of writing our reports in very sort of scientific, and I think it's correct, scientific ways with lots of jargon, but it's not immediately accessible to all the policymakers and decision makers across different departments. So what we found works well for us is to have continuous dialogue and with policymakers, knowing what they want and how they want to use your projections, but also making the time for the back and forth. We almost always find ourselves in meetings, even this far into the epidemic, but I think that has allowed us to, one, develop relationships, and two, communicate our models and our results in a far better manner.
Great. It's a very important point, I think, made very powerfully by both of you, that the modeling is a process and not just a number at the end of it, and it's important to engage with that. Thank you. There's an interesting cross-cutting question. So, Hsien-Ho, you spoke about estimations of the reproduction number, and Dan, of course, also you showed us a very nice, widely available methodology for doing so. One of the, again, anonymous question from the audience was, are there other measures other than R that are useful to describe the status of the pandemic? And perhaps measures that are maybe, they might be less informative, but they might be more stable and reliable. This is perhaps first for Hsien-Ho, then to Anne.
Okay, it's hard. I can give it a try. First of all, we need to know what we want in terms of stable and reliable. And I think there's no like ideal indicator that is both easily collected and also ideal and informative. But I think in addition to R, the basic epidemiology is always useful to know. For example, the epi curve or the incidence over time. And probably, as Sheetal just also mentioned, the excess mortality. So these are, I'm not sure if they're more stable, but they are probably require less assumption compared to the estimation of R, because it's the basic measurement. And I think also, I mean, my view is that the more dimensions or more metrics you have, you know, each of them can complement each other. So, for example, if you have some kind of contact tracing data to see the change of serial interval, as Anne just showed, will be very useful as well. And also to measure the delay from the onset to isolation. That's another aspect of the impact of controls. And even better, if you can measure the serology. Things like that. So I think depending on the level of efforts, these different kind of indicators or metrics all help to tell us something in addition to R.
Thank you, Hsien-Ho. Anne?
Yeah, I mean, I completely agree, and I think there are a lot of metrics that can be useful. They all sort of depend on what in the epidemic you're interested in, understanding or measuring. So again, having a sort of continuous measure of behavioral, I don't know, proportion of people who still wear face masks or wash hands or don't go to the office or things like that will also be important. But yeah, I've made the point before that I think the reproduction number at least is best understood together with the incidence. And the image I sometimes use is that the reproduction number is how fast you're going into a wall, and the incidence is how far you are from the wall. So if you have a reproduction number of 2, but you have 2 cases, is less bad than if you have a reproduction number of 2, but 100 new cases every day. So I think both of them jointly are really useful. And then I just want to come back to the stable issue, and this is really a problem because epidemics will behave very stochastically early on and later on when you don't have many cases. And so in those time periods where, as you said earlier, Nim, it's very important to know what's going on when you're at the start or when you're almost at the end. It's actually very hard to disentangle variability, true variability or changes in parameters underlying your epidemic from actually just stochastic variation or chance. And I think that's very hard, and therefore you need to be very careful for a longer time period in order to make sure things are under control.
And I suppose the important thing is that R is only one of several different metrics that we would be keeping an eye on. Thank you. So, and here's a question that relates to topics that were covered by both Sheetal and Hsien-Ho, which is that of behavior. So Sheetal, you mentioned, for example, that there were I think it was the Western Cape that the actual epidemic had behaved differently from what you had projected, and that you had looked at different potential reasons for this. And Hsien-Ho, you also mentioned about the fatigue that people in Taiwan are having in terms of responses to different population-based interventions. I think one of the perhaps a big unanswered questions for modelers, and I'm going to ask you to answer this question in a moment, is how do we get better at modeling these behavioral factors? And is there in your mind a prospect for being able to model this in a scientific way, or are we resigned to the fact that human behavior is so unpredictable that it's not something we're able to address using the tools we have? Perhaps this is one for Sheetal first, and then Hsien-Ho.
Thanks. So that's quite an unanswerable question, but I'll have a go at it. So I think I wouldn't say that it's a lost case. I say that we can. I think through collecting good data on behavior and perhaps this epidemic this pandemic has presented maybe a first opportunity for us to perform surveys and truly understand how people have responded to nationally directed interventions as opposed to voluntary interventions, to understand population behavior and network structures. I think perhaps there was never the impetus to understand and collect this data beforehand, but this epidemic has proved that it is entirely necessary. So I do think perhaps whether it's be waiting for the second wave or for the next epidemic to hit a particular country, that this we will be more prepared the next time, because there is already data collection underway in many countries to capture this behavior. So I think in the future we'll be able to capture scientific behavior, behavior in a more scientific way.
Fantastic, thank you. Hsien-Ho?
Yeah, I totally agree. I think, I mean, at least for me, I've never thought about this before, but this pandemic forced us to think about human behaviors. And I think before better modeling, we need better measurement of the behaviors. So as I just introduced, we're here in Taiwan, we're just start to think about how to better measure even this, we're sort of now in the sort of pre-outbreak period, and to establish this kind of baseline, using different sources of information, including questionnaire and things like the line survey, image analysis, social media analysis, and we're just starting to learn how these different sources of information can help us better understand human behavior. And I think once we have some kind of measurement, we may be able to start to think about how to model it, given this increasingly available different kinds of data about the connectiveness and mobility and the traffic, things, etc. But I think at first-hand data collection would be the most important thing. Yeah.
Fantastic. It's great to hear somewhat optimistic visions of modeling behavior in that sense. So what I'm going to do is I'm going to ask each of you, before we conclude, to maybe give a very brief reflection on, through your experience of modeling and in this, especially modeling in these emergency situations, if you like, what it is, perhaps one thing that you feel the modeling community could do best for the next emergency. And it's a question that will take some reflection, so perhaps to give you time to think about it, what I'd like to do is, while you're considering that, I'd like to handle I'll take the opportunity to handle one of the questions that one of the audience has posed, which is about India. It felt a bit unfair to pose that to you folks, but I do a little bit of work in India, so perhaps I'll try and address that, which is, in India, as we know, is the country with the second largest number of cases right now. And so the question was, do we have a sense of when the epidemic is going to peak there? From my own personal experience of the modeling work that we're doing there, it's very, very difficult to say. If it was difficult in other settings with better data, it's next to impossible in the Indian context. And what we do know is that so far we're seeing an epidemic that's very highly concentrated in the cities. It's mostly been an urban epidemic, but where the time may come where we slowly move to it being also and additionally a rural epidemic. And once that happens, then I think perhaps all bets are off. But great, so that was a brief answer to that question. So perhaps I can do a very quick round robin in the time we have remaining. 30 seconds maximum with each of you. Anne, could I start with you, then Hsien-Ho, then Sheetal?
Yes, sure. I'm going to go back to communication. I think that's really where modelers can do better in terms of communicating what their model results mean, really. And then the second aspect would be evidence synthesis, so working better together to try and understand why different models will provide different answers, but also try to reconcile. Sheetal said that different data sets, for example, that may not bring, the same information within a model. So I think for me, communication and sort of harmonizing data, but also modeling results so that it's clearer to the public and the users of our models what they should do with that information, really.
Fantastic. Thank you, Anne. Hsien-Ho?
Yeah. I would say, for a new emerging infectious disease, data collection and parameter estimation before modeling. Compared to SARS, we've done much better in this outbreak, but I think we can still do better. And in this regard, the modeler has to work with field people. This kind of cross-disciplinary interaction and collaboration is very important, and modelers can indicate and point out the important things to measure in the field. So I think we should kind of speak out more frequently. Yeah. Great.
And Sheetal, last word for you.
All right, last 2 words, perhaps. One would be to, I think that speaking from the context of LMIC, is that to reflect on shared experience within LMICs, and perhaps to be developing a pandemic preparedness framework. I think this would be vital in preparation for the next round or next pandemic. And lastly, I think one aspect that has been highlighted that we can do better in preparation for the next time is to train modelers, and again, particularly in LMICs, and to focus on training modelers so that countries have national modelers who can lend their services during an urgent time like this.
Fantastic. Thank you all, and it just remains for me to thank all of our speakers for some fantastic talks today, and I certainly enjoyed it, and I hope you, the audience, have enjoyed it equally well. And with that, thank you and goodbye.